pray. Almighty and gracious God, we thank you for the gift of another day. And Lord, we thank you for the opportunity to do good. We thank you for the opportunity to be a part of a community that cares for each other, helps each other, a community that works together. And so Lord, for these that have given up their time and energy, of the hours of their lives that have been spent working for our community, we give you thanks. Lord, we know that your hand is at work in the world before we see it, and so we ask that for these who work, that you will make evident your plans for us, and that good will come. We thank you for these meetings. We thank you for all the gifts in our lives. Pray that you will bless our community through these efforts and watch over us. This we pray in Christ's name. Amen.
Anyway, as far as the update on the hospital, I'm going to start out by talking about some of the rules that have come to play into things. First of all, the Texas Administrative Code rules require that a change of ownership application be submitted within 10 days of a facility's closure. And as you know, Timberlands gave us 8 days notice of the hospital closure, which certainly did not give the hospital district sufficient time to make any arrangements to meet that 10-day time frame. On July the 18th, Deborah Blackwell and Dr. Robert Greer, acting as representatives of the Houston County Hospital District, and former U.S. Congressman Jim Turner met with State Representative Trent Ashby and representatives from the Texas Health and Human Services and the Texas Department of State Health Services, requesting a waiver of that 10-day requirement. And then on July 20th, 2 days later, the district received a letter from John Hellerstedt, MD, Commissioner of the Texas Department of State Health Services, stating their intent to grant a waiver of the 10-day requirement for change of ownership if a new operator can be located and submits a proper application for change of ownership and an application for waiver by September 30th, 2017. This was an amazing process with a positive result and gives the district and our community the hope of reopening our hospital. I want to repeat, it is only a hope. The district still needs to find a partner and the financial resources to move forward in 60 days, but it is good news. So, that's the update on the hospital. The next thing we're going to do is approve independent contractor agreements. With the board's approval, I would recommend that we enter into independent contractor agreement with Jeff Perry, former CEO of Timberlands Healthcare, to aid with the administration of hospital business, and with Glenn Lehman to oversee the facilities management. There is a 30-day termination notice by either party in this agreement. The agreements are here if anybody would like to look at them. I think we've all discussed it. So at this time, I would entertain a motion to enter into these independent contractor agreements with Jeff Perry and Glenn Lehman.
I move that we enter into an independent contractor agreement with Jeff Perry.
You want to do them separately?
So we like.
I think that's fine. Okay. Do I have a second? Second. We have a motion and a second to enter into an independent contractors agreement with Jeff Perry. Any further discussion? All in favor, please say aye.
Aye.
Any opposed? We have, there's 1, 2, 3, 4, 5, 6 in favor and 1 abstention. It passes. The next thing is to approve our insurance policies. Oh, I'm sorry. Next, I'll entertain a motion to enter into the independent contractor agreement with Glenn Lehman. We have a motion and a second. Any further discussion? All in favor, please say aye.
Aye.
Any opposed? Okay, it passes. On to the insurance policies. Upon Timberland's departure, the district had to obtain both general liability and property insurance coverage. The general liability coverage was obtained through Rock Hill Insurance Company, and the premium was $5,407.51. The property coverage was obtained through underwriters at Lloyd's of London, and there are 2 tiers of coverage. The primary coverage is $10 million, and the premium is $47,565. Excess coverage of $24,531,000 is an additional premium of $26,827.53. We only purchased the first tier of the $10 million coverage for the premium of the $47,565. We can add the excess coverage at a future point if necessary. So I'm asking the board to approve and accept the insurance coverage as described.
Deborah, this is property insurance. on the hospital
Property and liability.
and liability.
I'll second that motion.
Okay, we have a motion and a second. Any further discussion or questions?
So this does not include these above 23,000.
We only did the basic 10 million.
Basic 10 million.
And they,
Okay, I have a motion and a second. Any further discussion? If not, all in favor, please say aye.
Aye.
Any opposed? Okay. Next, I want to discuss and possibly take action on the custodianship of the medical records. We have a choice of allowing Timberlands to maintain custodianship of patient medical records or to take back that responsibility. This will require a secure storage site and a person responsible for retrieving patient records when requested. With the hope of reopening the hospital and clinic, I recommend that we notify Timberlands that we want to be responsible for custodianship of the medical records.
so what's the plan for security? Are they here in the hospital? Is it in?
Yeah, go ahead.
Yeah. Explain what's
So,
involved.
so there is already a current medical record storage in this facility that's completely compliant about being locked up and secured. And it can continue to store those records.
What about people accessing? I'm sorry.
So personnel have to be identified to do that.
Well, okay. What about our patients? Are they going to make it like an appointment to come get them, or?
So there's a medical records request process. Typically, there's copies made and commonly given 3 times to come pick up the records.
Okay.
So we work with the patients, convenience of them to pick up the records.
Okay, so the medical records are secure here. Michael, you got a question?
I have a very important question.
You go ahead.
It seems to me like this guy worked for Timberlands. Why in the world would you want to hire him to do anything out here?
We
all work for Timberlands.
We all did,
No,
sir.
I'm here to speak. I'm asking a simple question. I mean, you're going into a contract with this guy. That doesn't make any sense to me. That's my question. Thank you.
Well, it would be any
I didn't ask you anything.
Well, Michael, I can tell you what I think, and I'm just one person.
I'm just bringing to everybody's attention that,
Okay.
you know.
Well, here's what I'll tell you. I think everybody has the same concern. Jeff moved here from where, Michigan, 4 or 5 months ago. In that 4 months, I've heard nothing but good things about him from the people that were working here, the local people. I don't know Jeff that well. I think the feeling of the board is that there needs to be somebody here in an administrative position. I don't know who you're going to have. Is there going to be anybody else? You and Glenn here? Okay, just these 2 people here at the hospital to access the medical records where it needs to be in it for a short period of time. I'm guessing, I don't have any idea, 30, 60, 90 days maybe. I don't know.
At what cost?
Rest of it.
Michael, I think let's address this in public comments. This is not the time to do that.
Anyhow, back to medical records. Now, you get your question?
Yes.
Okay. They're secure here in the building for anybody that's had treatment here. Okay. And when someone accesses, do they contact you, or do we have to have a maintenance person on site here, or some lady or somebody that's also Or do you and Lynn do this? Or do they make it?
Yeah, we have a phone number that any patient can contact to, and then we help them fill out the medical
Is
record.
that here? I mean, do they call somebody here?
Yes, it would be in this situation, and that is correct. As of current right now, it's here, and if y'all accept it.
Will we have somebody here, a lady or somebody answering the phone, or does it come to you? Or?
Well, that's one of the pending items about who
We're
would
just
do.
saying we will vote to take over these records, and the process will then be set up. Nothing to be set up, because right now, we don't have the records. We're just voting to say we'll be in charge, and then I'm assuming the system will be
And we would develop a system to make sure that the patient can continue to get their medical records, correct?
Now, if anybody is uncomfortable about this, we can table it, but, okay? All right, then I'll
Make
entertain.
a motion that we secure the records.
I second that.
Okay, we have a motion and a second. Any other questions, discussion? If not, all in favor, please say aye.
Aye.
Any opposed? I also wanted to put on the agenda to discuss and possibly take action on indigent care. Because if you all know that you probably may not, that the Texas Health and Safety Code defines the responsibilities of hospital districts in providing health care to eligible residents who are considered indigent. And this is probably one of the most important issues that a district has to take care of. And at this time, we don't have any ability to take care of our indigents, no sources. So I want to assure everybody that we will be working to establish some kind of application procedure and provide health care to eligible residents who reside in the hospital district service area and meet the minimum resource and income limits. So the board will be working to implement this application procedure. There's no action to be taken on this, but I just wanted to bring it to everybody's attention. Okay, I think we're down to discuss and possibly take action on our rural health clinic. Immediately upon closure of the hospital, members of the board began meeting with various individuals and organizations with the hope of finding a partner to help stabilize the health care in our community. We realized that the most critical need was to secure our doctors and advanced practice providers. These were the providers over in our clinic. We were committed to trying to reopen the clinic. Much discussion was held with both those providers who were also committed to staying in the community. We had our first meeting with the team from Christus, Trinity Mother Francis Health System on July the 5th, less than a week from the hospital closing. It has been an amazing 20 days of strategizing and planning. We think we now have a plan to reopen the clinic and hopefully go forward in looking at our options for bringing other healthcare services back to our community. At this time, I would like to introduce Scott Schmedley, who is the Group Vice President, Strategy and Business Development of Northeast Texas from Christus Trinity Mother Francis Health System, to tell you about their mission and hopes for our community. And we do ask the public not make any comments or ask questions until the public comments portion of the meeting. So I will turn it over to Scott.
Thank you, Dover. Judge Lovell, Mayor Klons, thank you for being here. I will say this, in the last 20 plus days, maybe right at 20 days, we've had an opportunity to get to know some members of the community, obviously members of the hospital district board, and then seeing the number of you who have come out in earnest to hear what is the latest developments on your hospital has been a very impressive process for us. It's also been a great deal of humility knowing that what this community has gone through and the difficulties with the sudden announcement and closure of Timberland. So please know that as we talk through these things, we have not had a lot of time to do much due diligence, and first and foremost in our mind was how it was that we could stabilize primary care services in this community, something that we do a pretty good job at Trinity Mother Francis. But when we talk about organizations, especially after potentially what's happened to you, I felt that it was extremely important for us to to share with you a little bit about who we are as an organization. What do we represent? What are the values that we hold to be truth? And so this is kind of an opportunity for us to talk to you about what is and who is Christus Trinity Mother Francis. So besides kind of talking a little bit about an overview of Christus Health, one of the things that we're working through, and if we're able to do that, is reopening primary care services, and I certainly want to provide a summary of what that would look like here in Crockett. Kind of why is it that we exist? We exist for the sole purpose of extending the healing ministry of Jesus Christ. That is what our organization is about. We're faith-based, and we're very blessed to have 3 congregations of sisters who have really, first and foremost, made everything that we do about how it is that we extend the healing ministry of Jesus Christ. What do we strive to be? We strive to be a leader, a partner, an innovator, and an advocate for health services and how we can improve the health status of the communities that we're in. And that's really kind of our aspirational goals. What is it that we can continue to do and offer in a way that improves the health status of the communities? What do we believe in? You know, these are the core values of how it is that we behave, how it is that we act, how it is that we want to be perceived, not just to the patients and the families that we serve, but also into the constituents that we interact with. Dignity, integrity, excellence, compassion, stewardship. When we had the opportunity and we were invited to come and meet with Deborah and certain members of the board on July 5th, one of our ministry leaders, I think, said kind of it best when speaking about our values. He said, compassion in many ways is when you have someone who will step into your shoes during your time of chaos. And I think what we've attempted to do throughout this entire process of working with the district, working with Jeff, working with Glenn, is really conduct ourselves in a way that they see that our values hold true with how we would behave today and tomorrow as we continue to work with them on possibly figuring out how it is that we relaunch health services in this community. Our culture is extremely important. It is the fabric of how it is our values and our mission really begin to exist. We want to be, and we are a diverse community. We serve diverse communities. We're in 3 different countries. We provide health services to over 5,000 different locations in different ways. And so it's extremely important for us to be thinking about how it is that we create a culture and sustain a culture that is characterized by honoring heritage, by engendering trust, creating a sense of engagement, accountability in the things that we say we will do and following through on those. Also operating with a sense of urgency, moving things forward. And then how it is that we can spin this in creating a culture of fun. And I think in a lot of ways we do that by really empowering decision making and empowering people to offer their fullest of their abilities as we go through what we do each and every day. Now that's kind of like the mind and soul of Christus Health. And let me talk a little bit about the body. We have nearly 9,500 different associates in Northeast Texas. We have 14 hospitals, 9 of those are acute, 6 are post-acute, over 1,600 licensed beds, and a total of nearly 2,500 medical staff members. The Christus Trinity Clinic itself is a top 50 physician group in the U.S. In fact, I would argue that in the state of Texas, you really only have 2 truly integrated health systems, Baylor Scott and White, which was really the Scott and White Foundation model, and Christus Trinity Clinic. We really operate like a dyad. Our medical staff are partners with us in everything that we do, how we contemplate operations, strategy. And so it really creates a very vibrant and a very collegial environment for us. We have 89 clinic locations. We're hoping for 90. We have over 600 CTC providers that are made up of nearly 50 different specialties. And so we think that we offer a lot with a great deal of humility, we say that. We also think that we create a culture where people want to be a part of it. Our size and scale is around a purposeful pursuit. It's not to be big just to be big. It's really about how top talent, how is it that we're able to really drive values-based care models How is it that we create market relevance? How is it that we can bring purchasing power so that it makes our assets more economically viable? How is it that we can improve the standard of care and begin to consistently deliver that across our spectrum of where it is that we offer those services? One of the things that I was really impressed with, and for me this is day 52 on the job with Christus, but one of the reasons that really attracted me to come to this organization, especially specifically in Northeast Texas, was their pursuit around trying to achieve top 10% national benchmarks and standards in all things that they measure themselves against. And I will tell you, in some of those things we do exceptionally well, and in other areas we still have some opportunities to continue to improve, but it's a learning organization. It continues to be innovative, it falls back to its mission and its values in that way. And then lastly, when we find something that we can improve upon, our ability to begin to rapidly deploy that to all of our other areas that we provide care is extremely important to us so that we, again, raise that level of service, that standard. That is kind of the body. Now let me talk a little bit about the Trinity Clinic here in Crockett. What we envision is having a physician and a physician extender model of care. We would love, and we are working with the providers of the Crockett Clinic and also the providers that were in the rural health clinic to come into Trinity Clinic. If we are able to, and our hope was to really retain the providers that you and your neighbors have been seeing for so many years and stabilize that. Initially, we would be open just like a normal primary care clinic setting. We envision it being open from 8 a.m. to 5 p.m. I know that we're already quickly contemplating how it is that we can offer extended hours, knowing that there is not a functioning emergency department in this community. We are looking at how it is that not only are we doing this by appointment, but offering same-day availability. And we will definitely create a schedule that allows people to come in through that. I would say that our scope of care will encompass all ages, genders, organ systems, and every disease entity. And then you can kind of see that quote, our family medicine providers are dedicated to offering comprehensive and quality health care for the entire family. We will partner with you to maintain your health and preventive care and treatment of illnesses and injuries. And when serious health problems affect your family, we believe that we have great access to specialty care in almost every single specialty to help people with their affliction. So we're excited about the possibility of being here. We're very humbled to be asked to consider being a part of this community and approaching it as such. Unless there's some questions you need to field right now, that kind of concludes my presentation. I appreciate your interest in allowing us time to introduce Christus, and we look forward to having a long-standing relationship here in this community.
I hope y'all appreciate the fine organization that we've decided to partner with. Sometimes you have to go through trauma and great trials, and you only hope that when you go through that, a better door opens, better opportunities. We still have a long way to go, but we're making progress in a very short period of time. Anyway, the next step would be for us to negotiate a lease agreement and any other ancillary documents with Christus Health for approximately 15,000 square feet on the second floor of our medical office building. And I need a motion to do that. I would like to possibly...
I move to authorize and appoint the Finance Committee consisting of Deborah Blackwell, Jim Dowell, and Dr. Robert Greer to negotiate final terms of a lease agreement and any other ancillary documents as are necessary with Christus Health for the lease of office space to operate a health clinic located at 1050 East Loop 304.
I'll second.
Okay, we have a motion and a second. Does anybody have any discussion or further questions on negotiating the lease?
I just want to give you a brief synopsis of the past 20 days. Well, it's been a few more days than that, but since Little River, we have contacted a number of other possible partners. And we have heard 5 or 6 different presentations, both by individuals and by other groups. No one has moved with the sense of urgency that Christus Trinity Mother Francis has. There's been some enthusiasm about us, but no one with a real plan. Scott and his team have put together a plan that has pushed both their time and their resources to come to our aid. I just can't speak highly enough of the effort. Here you go. I also want to commend Deborah Blackwell. She has a business. She's a businesswoman. And she has given tirelessly of her time and effort and of her car and her gasoline to bring us to this point. And I'm excited about taking off from this point.
Thank you, Bob.
I have been in all those meetings with Dr. Greer and with Deborah and with Scott and his team from Christus and with the other providers that came in to speak to us. And while they were all very nice people and very interesting, this particular group impressed us with their wonderful preparation and their earnest desire to establish a clinic in that 2-story building over there that we used to call the Rural Health Clinic, where Dr. Brandon Herbert was, and our PAs. And as Scott has explained, they have come up with what we believe is a viable, wonderful plan to include a couple of local physicians whom you know, and the physician's assistants who were there. And as he stated, that could all not be finalized by tonight, but it is well on its way and we're extremely optimistic about it. So I can't say enough good things about Christus and what they have presented to us so that we can get healthcare back up and running quickly. And nobody gave a timeline, but we're talking about within 15 days or so, right in that time frame. So I wanted to say a little bit more about that. Thank you.
Okay, I think we still have a motion and Anyway, I think we have a motion and a second on the floor. Do we have any further discussion? If not, all in favor, please say aye.
Aye.
All, any opposed? None.